Guided Tissue Regeneration on Site 14 Mesial, using tissue from Mesial, presented by Dr. Dan Holtzclaw. This patient presented with a fixed partial denture on teeth 12 by 14. Tooth number 14 had been previously treated many years in the past with a root amputation. The tooth now had an 8 mm probing depth, and tooth number 14 was in jeopardy of being lost. Loss of tooth number 14 would result in removal of the fixed partial denture and significantly alter the patient's ability to chew on his left side. Note that only 1/46 millimeter of bone remains on the mesial of tooth number 14. The patient did not want a dental implant due to the fact that ridge augmentation and a sinus lift would be necessary prior to implant placement. He wanted to keep his fixed partial denture on teeth 12 by 14 at all costs. The intrabony effect at the mesial of tooth number 14 was treated by guided tissue regeneration using Mesial bone allograft and pericardium membrane. Shown here is healing at 6 months. At 6 months after surgery, note the significant formation of new bone at the mesial of tooth number 14. Approximately 3.7 millimeter of new vertical bone was regenerated with the GTR procedure using Mesial bone allograft and pericardium membrane. Here is a before and after radiographic comparison. Tooth number 14 is now stable, and the patient can chew on the fixed partial denture 12 by 14 without worry. This procedure saved the patient over $10,000 of future treatment costs now that additional bone grafts and placement of dental implants is no longer necessary. Presentation by Dr. Dan Holtzclaw, Lone Star Periodontics and Dental Implants, Austin, Texas.